Every mother deserves the chance to live, and every child deserves the opportunity to know their mother. Yet, in the United States, this promise remains unfilled. Maternal mortality is one of the greatest public health crises of our time. Unlike other high income countries, our rates are not improving. In fact, they are worsening. Behind the statistics are families who have lost mothers, daughters, and sisters to complications that are, in many cases, preventable. This story is not about numbers. It is about lives, it is about justice, it is about equity. So the question becomes, why are mothers still dying in one of the wealthiest nations in the world? How is it possible that in the U.S. in 2021, it was recorded that nearly 33 deaths for every 100,000 live births, when most of these deaths could have been prevented? And mostly important, what role can health service administrators play in changing this reality? These are not abstract questions, they are urgent, life or death questions that demand answers, and they demand action. This crisis is especially severe for Black women. According to the CDC, Black women are nearly 3 times more likely to die from pregnancy-related causes than white women. What makes this disparity even more alarming is that it cannot be explained away by income, education, or even lifestyle factors. Well-educated, financially secure Black women face higher risks. This points to systematic inequities, implicit bias, and a healthcare system that often fails to listen and respect Black women. Beyond the numbers, the impact is profound. Maternal mortality is just not a women's health issue, it is a societal crisis. Recognizing the urgency of this issue, policymakers have proposed and advanced solutions. One of the most comprehensive efforts is the Black Maternal Health Omnibus Act. This legislation takes in a multifaceted approach. It invests in the community-based organizations that understand the unique needs of mothers. It works to diversify the prenatal workforce by training and supporting more midwives and doulas. It addresses maternal mental health and substance use treatment, and it strengthens data collection to identify where gaps exist. At the same time, states across the country are extending postpartum Medicaid coverage from just 60 days to a full year. This closes a critical gap because many women die after childbirth when coverage has traditionally ended. These policy responses are steps in the right direction, but they are not enough without effective implementation. No mother should die giving birth. This is the ultimate call to action. The Black Maternal Health Omnibus Act, Medicaid expansion, and other reforms provide a foundation, but it is a health service administrator's job to determine whether these policies succeed. By championing cultural competence, expanding access to equitable care, and advocating for systemic change, administrators can change lives. This work is not optional, it is essential. Together, we can build a healthcare system that listens, that respects, and that protects every mother, regardless of race, income, or background. Because at the end of the day, saving mothers means saving families, saving communities, and securing a healthier future for all of us.